Have you ever wondered why some medical tests are praised as life-saving, while others quietly drain your wallet and put your health at risk? Here's the truth. Millions of people over 50 are pressured every year into unnecessary medical procedures. Tests that sound sophisticated, scientific, and even urgent. But in reality, they deliver little benefit while exposing you to hidden dangers. And the shocking part? Most doctors won't tell you this. Not because they're bad people, but because the medical system is built in a way that rewards more testing, not smarter testing. Now pause for a moment and think. When was the last time a doctor recommended a scan or a test, and you nodded along without fully understanding what it meant? Did you ever feel that uneasy thought, do I really need this? If so, you're not alone. I'm here to tell you that questioning medical advice doesn't make you stubborn or reckless. It makes you wise, cautious, and protective. Over the next 20 minutes, I'm going to reveal 5 common medical tests that many people over 50 are urged to take, yet they may do you more harm than good. I'll explain what each test is, why it's often unnecessary, and most importantly, what safer alternatives exist that your doctor might never mention. But before we dive in, let me tell you why this matters. I've seen too many people, smart, caring people, put through stressful, invasive tests that gave no clear answers. Instead, they left them with anxiety, hospital bills, and sometimes side effects that lasted weeks, months, or even years. Here's the good news. Once you know what to watch out for, you gain back control. You'll know how to ask the right questions, push back politely, and demand the care. And I promise, this one will surprise you. The first test you need to know about is the CT scan with contrast dye. On the surface, it sounds like a miracle of modern medicine. Doctors say it gives them a clearer view of your organs, your blood vessels, and any potential hidden problems. And many people over 50 are told, sometimes urgently, that they must get one. But here's the hidden truth. For many routine checkups, CT scans with contrast are unnecessary and even risky. Here's why. The contrast part of the test involves injecting a chemical dye into your bloodstream. This dye makes certain areas light up on the scan so doctors can see more detail. Sounds good, right? But what most patients aren't told is that these dyes can put a huge strain on your kidneys. If you're over 50, there's already, and here's something even more shocking. A study published in the Journal of the American Medical Association found that contrast-induced kidney damage happens far more often than patients are led to believe. Think about it. You go in for a test just to be safe, and you leave with a brand new health problem that never needed to happen. And that's not the only issue. CT scans expose you to high levels of radiation, in some cases, hundreds of times more than a simple chest X-ray. And while one scan may not seem like much, many people end up having them repeatedly, year after year. Over time, that radiation adds up. So why do so many people still get pushed into these tests? The answer is uncomfortable: money. CT scans are profitable. Hospitals and clinics earn thousands of dollars per scan, while safer, simpler alternatives like an ultrasound or MRI without contrast are often ignored or downplayed. Now let me ask you this. If your doctor suggested a CT scan tomorrow, would you feel confident asking, is this really necessary? Are there safer options? That single question could save you enormous stress and protect your health. Here's my advice. Unless it's a true emergency, like ruling out internal bleeding after an accident, always ask about alternatives first. Many times an ultrasound, a regular MRI, or even a basic blood test can provide the answers doctors need without the risks. Remember, your health is not a business. You have the right to say no. The second test on our list is the PSA blood test, often recommended for men over 50. PSA stands for prostate-specific antigen. Doctors present it as a let me explain. Your PSA levels can rise for many harmless reasons: an enlarged prostate, a urinary tract infection, even recent exercise or sexual activity. But when the test comes back elevated, most doctors immediately recommend more testing, often a biopsy of the prostate. And that's where the trouble starts. Prostate biopsies are invasive. They involve inserting needles directly into the prostate to take tissue samples. This can lead to infection, bleeding, and long-term complications. Some men even end up hospitalized. And if the biopsy finds cancer, here's the kicker: it's often the kind of slow-growing cancer that would never have caused harm in the man's lifetime. But once the word cancer appears on your chart, doctors push treatments like surgery, and those treatments, they come with life-changing risks: erectile dysfunction, urinary incontinence, chronic pain, all from a cancer that might never have needed treatment at all. So let's put this in perspective. According to the U.S. Preventive Services Task Force, for every one man whose life is saved by PSA screening, dozens of men are overdiagnosed and overtreated, suffering lifelong consequences. Think about that. A test promoted as life-saving can actually destroy quality of life for many. Does this mean the PSA test is useless? Not entirely. In some cases, especially if you have strong family history or specific symptoms, it can provide helpful information. But for routine screening of all men over 50, the risks often outweigh the benefits. So here's my advice. If your doctor suggests a PSA test, don't just nod and roll up your sleeve. Ask these 3 questions first. What would we do differently if the result is high? Are there safer ways to monitor my prostate health? Given my personal history, do I actually need this test right now? Many times, careful monitoring, like tracking symptoms, lifestyle improvements, and occasional checkups, offers a safer path than jumping into invasive procedures. Remember, not all early detection is good detection. Sometimes the cure is worse than the disease. Now, let's talk about the colonoscopy, a test that most doctors recommend once you turn 50. The idea is simple. Insert a flexible camera into the colon to check for polyps or signs of cancer. And yes, colonoscopies can save lives by detecting early-stage cancers. But here's the problem nobody warns you about. The sedation and medications used during this test can create hidden risks, especially for seniors. Let's break it down. Most colonoscopies are performed with anesthesia or heavy sedatives. These drugs lower your blood pressure, slow your breathing, and affect circulation. For younger people, the body usually bounces back quickly. But for seniors, particularly those taking blood thinners, blood pressure medications, or heart drugs, this can trigger complications. Here's what can happen. A sudden drop in blood pressure during sedation may reduce blood flow to the brain. This in turn can cause mini strokes or transient ischemic attacks within hours or days. If you're already on blood thinners, the insertion of biopsy tools during the test can increase the risk of internal bleeding. And yes, there are real cases. In a 2021 study of older adults undergoing routine colonoscopies, researchers found a measurable spike in post-procedure neurological symptoms, like slurred speech, dizziness, or unsteady balance, within 72 hours. Most weren't full strokes, but they were clear signs of reduced blood flow to the brain. Here's a real-world example. A 76-year-old woman from California went in for a routine colonoscopy. She had no major symptoms, just following the recommendation. She was on daily aspirin, as many seniors are. 2 days later, she began stumbling while walking and couldn't get her words out. At the ER, doctors confirmed she'd had a minor stroke, likely triggered by the combination of anesthesia and her blood thinner. So, does this mean you should never have a colonoscopy? Not at all. Colonoscopies can be life-saving for high-risk patients. But what it does mean is this: don't agree to one just because it's been 10 years or it's routine. Here are steps to protect yourself. Ask if a colonoscopy is truly necessary right now. If you have no symptoms and no family history, a less invasive test like a stool DNA test, Cologuard, or fecal occult blood test may be a safer option. Tell your doctor about all medications, especially blood thinners and aspirin. Ask whether you need to stop them temporarily. Discuss sedation options. Some colonoscopies can be performed with minimal or even no anesthesia, greatly lowering your body may need a few days to rebalance. Here's the takeaway. The colonoscopy itself isn't the danger. It's the combination of age, medications, and sedation. For seniors, that mix can quietly tip the balance toward complications. So always ask, is this test necessary for me right now? And what are the safest options available? Because when it comes to prevention, safety should never take a backseat. Now, let's move to another test that seems completely harmless, the MRI scan. MRI, or magnetic resonance imaging, is one of the most powerful tools in modern medicine. It can reveal tiny tumors, soft tissue damage, even early signs of neurological disease, all without radiation. Sounds perfect, right? But here's the hidden catch. Many MRIs are ordered with contrast dye, and that's where the risk comes in, especially for people over 60. The contrast used in MRIs usually contains gadolinium, a heavy metal. In theory, your kidneys should filter it out quickly. But in older adults, especially those with reduced kidney function, that process can be much slower. When gadolinium lingers in the body, two problems can occur: nephrogenic systemic fibrosis, NSF, a rare but devastating neurological effects. Researchers have found gadolinium deposits in the brains of patients who've had multiple contrast MRIs. Symptoms may include dizziness, brain fog, and memory issues. Here's what's really alarming. Kidney function naturally declines with age, even if you feel fine. And many seniors have early-stage kidney disease without knowing it. In a 2019 radiology study of over 2,000 patients aged 65 and older, about 5% developed neurological symptoms like headaches, blurred vision, or balance issues within a week of a contrast MRI. These weren't full strokes, but they were warning signs of stress on the brain and circulation. Take the case of Harold, a 79-year-old veteran. He told researchers, "I wish someone had warned me. I would have asked more questions." So, how can you protect yourself? Here are some smart steps. Always ask if contrast is truly necessary. Many MRIs can give enough detail without it. Request a kidney function test, eGFR, beforehand. This is a simple blood test that shows whether your kidneys can handle the dye. Tell your doctor about any past reactions to imaging tests. Even mild dizziness or nausea can be important clues. Explore alternatives. For some conditions, ultrasound or a CT scan without contrast may provide the answers without the risk. The bottom line is this: the MRI machine itself isn't the danger. It's the added chemical that your body might struggle to clear. So before you say yes, ask, Can we do this without contrast? And if not, is my kidney function strong enough to... Finally, let's talk about a test that seems so simple and safe, most people don't even think twice about it: the carotid artery ultrasound. This test uses sound waves to look at the two main arteries in your neck that carry blood to the brain. It's painless, takes only a few minutes, and doesn't involve needles or radiation. Sounds harmless, right? But here's the danger. Carotid ultrasounds can lead to unnecessary and risky surgeries. Here's why. As we age, it's normal for plaque to build up in the arteries. Doctors call this narrowing. In many cases, the narrowing is mild and doesn't cause symptoms. For seniors with no dizziness, vision problems, or weakness, the safest approach is often watchful waiting plus medication. But when a carotid ultrasound shows, say, 50 to 60% narrowing, some doctors immediately refer patients to vascular surgeons. That can lead to procedures like stenting or carotid endarterectomy, both of which carry serious risks, including stroke during the surgery itself. The New England Journal of Medicine published a large study following over 3,000 seniors with mild carotid narrowing but no symptoms. The results? Patients who stuck to lifestyle changes and medication actually did better than many who had surgery. In fact, some of those who went under the knife suffered strokes because of the operation. Let's make this real with a story. Helen, an 82-year-old from Pennsylvania, felt perfectly fine. Her doctor ordered a routine carotid ultrasound just to be safe. The scan showed 65% narrowing. Within weeks, she was scheduled for surgery. Tragically, Helen had a small stroke during the procedure. She survived, but was left with permanent weakness on her right side. Later, she said, "I wish I had known that doing nothing might have been safer." So, how can you protect yourself? Here are some important steps. Ask why the test is being ordered. If you have no symptoms, does the scan really change your treatment? Don't panic at mild narrowing. Plaque buildup is common with age. Often, the best treatment is managing blood pressure, cholesterol, and lifestyle. Avoid rushing into surgery. If your doctor suggests a procedure, always ask, "What's the risk if I just keep taking medication and monitoring this?" Get a second opinion, especially before any vascular surgery. Different doctors may give very different recommendations. Here's the truth. For many seniors, unnecessary tests can start a chain reaction that leads straight to risky, unnecessary surgery. Remember, sometimes the safest decision is no action at all. We've covered a lot today. 5 common medical tests that many seniors are told they need, but that can sometimes cause more harm than good. Let's quickly recap. Routine CT scans can expose you to unnecessary radiation. Annual full-body checkups may create false alarms. Vitamin D blood tests are often repeated when they don't need to be. Stress tests can trigger risky procedures without clear benefit. And carotid ultrasounds, while painless, may push some into surgeries they don't actually need. Now here's the important takeaway. Medicine is powerful, but it's not one size fits all. Just because a test exists doesn't mean it's right for you. The truth is, the best healthcare decisions often come down to asking questions. Do I really need this test? What difference will it make in my treatment? What are the risks if I don't do it? When you ask these questions, you take back control of your health. But let's be clear. I'm not saying you should refuse every test. Some tests absolutely save lives. What I am saying is this: be informed, be cautious, and don't be afraid to get a second opinion. And now, I want to turn it over to you. Have you ever had a medical test that you later wondered if you really needed? Did it help you? Or just cause more stress? Share your experience in the comments below. Your story could help someone else make a smarter decision. If you found this video useful, do me a favor. Hit the like button, subscribe to the channel, and ring the bell so you don't miss future health updates designed especially for seniors. And remember, Sometimes the best medicine isn't another test. It's knowledge, lifestyle changes, and taking care of yourself in the simplest ways. Stay informed, stay healthy, and I'll see you in the next video.